Do you worry that the chest pain you get is not related to a panic attack, despite being told by a doctor or cardiologist that it is? Do you worry that the test results may have missed something? Because how can a panic attack possibly cause chest pain like this? It just doesn't make sense. But it will after this video. Of course, if you've not been checked out by a doctor for the cause of your chest pain, then you should always get it checked out. But if you have had tests like an angiogram showing that your heart is fine, then my animated friends and I will explain what might be causing the chest pains that you get when you have a panic attack, and answer some more important questions that you might have. I have already explained in my cardiophobia video how muscle tension, IBS and GERD can all cause chest pains. But there is another cause that can happen specifically during a panic attack, and I will explain the mechanics of this from what I've learned from reading numerous studies on the subject. So the most common cause of chest pain during panic attacks is hyperventilation, and I will explain why this is. When you hyperventilate, you blow out more carbon dioxide, and as the carbon dioxide levels in your blood drop, it makes the blood become more alkaline. Apparently, this can cause arteries or blood vessels in the heart to constrict, causing feelings of tightness and heaviness in the chest. Other effects of the blood being more alkaline are pins and needles and even numbness around the mouth. Also, during hyperventilation, the rib muscles work really hard, and this can feel like a dull ache on the left side. If you also suffer from ectopic heartbeats, these effects of the alkaline blood can cause a sharp pain with each ectopic beat. Check out my video on ectopics if that's something you worry about. So the next question you may ask is this dangerous? Well, if the cardiologist has declared that your heart is healthy, then your heart should be able to handle this. It's a very resilient organ. But I'm sure you still want to stop these symptoms. You basically need to normalize your breathing. Frequently, people breathe fast and shallow during a panic attack. So put your hand on your stomach and breathe so that your stomach rises and falls with your breathing. But don't overcompensate. Don't take massively deep breaths, as they may make you feel dizzy. And some say that cupping your hand over your mouth will increase the amount of carbon dioxide you breathe in, but I'm not convinced that that's a good idea. A better approach, of course, is to try and stop the panic attacks in the first place, or at least reduce their frequency and their intensity. That's best done with the support of a CBT therapist, but if you prefer a self-help approach, then try my 8-video series on panic attacks. If you have found this video useful, please give me a like.